Hello, I am Dr. Priya Timothy, the Glaucoma Specialist at Zamindar Microsurgical Eye Centre, Kalyan Nagar, Bengaluru. I will be speaking on intraocular pressure or the pressure of the eye. Intraocular pressure is a medical term used to describe the pressure inside your eye. The intraocular pressure is an important part of your vision and the eye's physical health. Our eyeball is filled with fluid. In the back of the eye, we have a thick viscous fluid called the vitreous humour, and in the front of the eye, we have a thinner watery fluid called the aqueous humour. Now, this fluid is produced 24/7 by the eye, and there is an equal amount of drainage of this fluid from the eye. That means that there is a production and the drainage which is going on throughout the day and night. At any point, if there is an increase in the production of the fluid or there is a blockage to the drainage of this fluid, it raises the eye pressure and that impacts the optic nerve. When there is an increase in eye pressure, we call it ocular hypertension. That means that the pressure of the eyeball has increased. Now, typically, the pressure in the eyeball is within the range of about 10 to 21 millimeters of mercury. Anything which causes that pressure to increase could impact the optic nerve, and this leads to a condition called glaucoma. As you might know, glaucoma is an irreversible disease, and if left untreated can lead to blindness and complete loss of vision. There is an angle in the eye, a drainage angle, between the colored part of the eye called the iris and the white part called the sclera. In some conditions, this angle might get narrowed down and it leads to a condition called angle closure glaucoma. The most common cause of having a high intraocular pressure is usually hereditary. But there are other conditions which could lead to the same thing. Trauma to the eye can damage the area where the fluid drains, and that can lead to glaucoma. Then the use of over-the-counter steroid drops for common eye conditions like allergy or red eye or watering can also increase the eye pressure. Now I will be speaking on how we measure this intraocular pressure. You must have gone to your eye specialist and they would have told you that they are going to check your eye pressure. Now there are basically two types of instruments which could be used to check this. There are the non-contact tonometer, is a machine that is used to check the eye pressure, and there are contact tonometers. Now the non-contact tonometers are typically a machine where you place your face in front of and you feel a puff of air on your eye and you can measure the eye pressure. The contact tonometers are those where the instrument actually touches the eye, the front of the eye called the cornea, and records the eye pressure. Now the contact tonometers are the more accurate instrument for checking eye pressure. Before a contact tonometry is done, the doctor will instill some local anesthetic drops into your eye, make you close your eyes for a few minutes. Then they will touch the eye with a strip of fluorescein paper, which is a dye, and they will check your intraocular pressure with an instrument called a tonometer. Now, you will not feel any pain and you will not feel anything while this test is being done. But you must ensure that you cooperate by opening your eyes wide and not blinking. It is very important that you understand the necessity of having your eye pressure checked, because a disease like glaucoma is a silent disease where you will not know that you have the problem unless your intraocular pressure is checked. You will be asymptomatic in most cases, except in cases like angle closure glaucoma, where there you will have redness, eye pain and blurring of vision. Hence, Next time you go for your eye test, you must insist that your eye pressure is checked so that these diseases can be found out at the earliest and you can be treated for the same.